Hello, class. Thank you for having me here at your school at a sports medicine class. I'm very happy to be here, and thank you, Miss A, also for inviting me. I'm Amy Tech. I'm a physical therapist assistant, and today I will be giving you guys a presentation on rotator cuff. All right, so let's go ahead and get started. Today's presentation will be on rotator cuff tears. Let's go ahead and talk about some objectives that we will be describing today and going over. So the first thing is we're gonna do a description of what a shoulder rotator cuff tear is and their causes. We will also be talking about giving explanation of what muscles are involved in the rotator cuff and also demonstrate where they're located and their functions. All right. The other thing we will be talking about is differences between partial tears and surgically repaired tears or complete tears that can happen in the rotator cuff. So we will also be talking about treatment options and surgery recovery and also some preventions to prevent our rotator cuff. All right, so the muscles involved are supraspinatus, and I know these are all weird. These are all weird names. You might not know them, you might do, but I'm just gonna give you guys the names and then I'll tell you guys where they're at and what they do, okay? So supraspinatus is located in the back. When we look in the back, this is where the muscle is at. And supraspinatus allows us to do shoulder abduction. Shoulder abduction is here. Let's all do it. Shoulder abduction. Good job. All right. For our infraspinatus muscle, it allows us to do external rotation. So external rotation, external rotation. Let me all see you guys do it. Good job. All right. And then our teres minor helps us also with external rotation. So it's a smaller muscle in there that also allows us to do external rotation. For our last muscle that is involved is subscapularis. That allows us to do internal rotation, or if you can see it here, internal rotation. So those are the four muscles. An easy way to remember these are SIT, S-I-T-S. So let me show you guys up here. I'll be passing this one around. I put some little arrows so you guys can see exactly where they're located. So this one, we're looking at the anterior view or the front view. And this person is in the anatomical position. So with the arrow here, we can see our subscapularis muscle, and it's right inside our shoulder. Then on this posterior view, we are able to see supraspinatus, which means supra, so it's on top of the scapula, and then infraspinatus, infra bottom, below the scapula, and then we could also see the teres minor. This is a smaller muscle in here. All right, so we'll be passing around this thing so you guys can all have a look and see where they're located, okay? All right, so what is a rotator cuff tear? A rotator cuff tear is a group of muscles. Well, the tear is something that is an injury, right? But the rotator cuff is a group of muscles, which were four, and these hold a shoulder blade together. There are two types of tears when you have a rotator cuff tear, and it could either be a partial tear or it can be a complete tear. So let's talk about a little bit the differences between them. So one of them is dependent. The partial tear is dependent on the deepness. They both are. With the partial one, it's roughly 1 milliliter deep, and then it could be less than an inch. So from 1 milliliter to less than an inch is what we consider a partial tear. For a complete tear, it's a little deeper. It goes through the tendon. Tendon means tendon is what connects the muscle and the bones together. So that means that the whole tendon is torn and it separates from the bone. So I passed out a picture of this one up here, so you can see the difference between a full thickness tear and then a partial thickness tear. Let's go ahead and talk about some causes for the tear. So something that could be an increased risk for tear can be a family history of rotator cuff injuries. The other thing is poor posture. So all of you that are sitting down like this, let's go ahead and correct our posture. We don't want to have any rotator cuff tears. All right, and then the other thing could be aging. once we age, there's a lot of other things that can happen, and a rotator cuff tear is one of them. So repetitive movements is another cause, and I don't want to scare all of you athletes out there, but it can be possible, you know, for someone to get a tear. So sports, how many of you guys play sports here? All right, I see your hands. I used to play sports too. Okay, one of the sports that could cause a rotator cuff tear could be baseball, tennis, volleyball, softball, basketball. So any sport that uses your shoulders, okay? Another cause could be occupations or our works. So all the carpenters, painters, I'm not going to say all because it doesn't happen to all, but it could be carpenters, painters, gardeners, certified nurse assistants. They're constantly carrying patients and transferring them from one place to another. And then people who work on warehouse, they're doing overhead movements using their shoulder a lot. Another cause for a tear could be accidents or just any fall, a traumatic fall on the shoulder. So say you fall and you land on your shoulder, that could be a cause for a tear. Also dislocation of shoulder, either anteriorly or posteriorly, that can cause a rotator cuff tear as well. All right, so what can be treatment options? Partial tear, you usually wear an arm sling or just rest your shoulder because there is pain until you're seen by a medical professional. Another thing that could be a treatment is for stretching, strengthening. There's also anti-inflammatory medication that will be prescribed to you to decrease the pain or manage the pain. Physical therapy is another way that we can treat a partial tear. For complete tears, there's surgery most of the time just to repair those tendons. And the surgery is arthroscopically, which means there's small incisions. So you won't have a huge scar right here. There's small incisions around the shoulder. And then if the tear is non-repairable, so if the tendon is completely torn and there's no way of curing it, there's also a reverse shoulder replacement in which the ball and socket joints are replaced by metal similar shaped. So it's our shoulder is a ball and a socket joint. And when these things are torn and there's no way to repair it, there's metals that are shaped similarly and are inserted in there so that our surgery can be, so that our shoulder could be repaired. So then lastly, after your surgery, you will be going to physical therapy just to gain some mobility and also strengthening. All right, for surgery recovery, I'm going to be going over the names of the exercises you guys will be seeing. I'm going to play some videos for you guys after so you guys can know exactly what they are. So we have isometrics, which is some sort of strengthening. We have pendulums, which increases blood flow to the joint. We also have passage range of motion. That's what ROM stands for. Passage range of motion is when a therapist or a clinician is assisting the patient to move the shoulder. We also have active assisted range of motion, which is pulleys or using a cane. And then active range of motion would be the patient doing abduction and all the other movements such as flexion, external rotation, internal rotation, and scapular retraction to recover from that surgery. So all of these things, we will be seeing some videos for it, okay? And then some preventions. Lastly, to avoid a rotator cuff would be some stretching, and I'll give some examples such as doorway stretch, side lying, external rotation or internal rotation. Then there's also strengthening exercises. I will be going over some rows, shoulder extensions, using TheraBands and dumbbells. And then any other scapular or serratus shoulder strengthening. All right. Someone asked, if I have a complete tear on my rotator cuff, do I have to get surgery? Such a good question. You don't always have to get surgery. A complete tear can be treated in physical therapy through strengthening, through stretches, but it's just a longer process. So surgery is to recover faster, but you can also be treated without surgery. I see another question here. It says, how can I tell I have a tear? Another good question. Doctors usually can tell if you guys have if someone has a rotator cuff tear using an MRI examination or an MRI scanning. This is called a magnetic resonance imaging, and those can detect muscle tears or tendon tears. So they use MRIs most of the time.